I'm Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakanna, one of the co-founders. And every Wednesday, every single Wednesday night, we do a topic and we tie in CBD. And I was asked by one of our business partners, who I think is out there, I think it's Mia, who asked me to do a topic on lymphedema. So if you have a burning desire to find out more about a certain condition and how to tie in CBD to see how it can assist with that condition, just email me and I will get to your topic each and every Wednesday night. Okay, so the lymphatic system, like this system is pretty important, right? It's one of the most important parts of the human body. In fact, it is part of our immune system. Many illnesses are related to the lymphatic system. So if it's untreated, it can cause some serious disorders. And it is, just think of it as our body being able to eliminate toxins. So it's almost like a sewage sort of system where toxins are being removed through our lymphatic system. And in this diagram, you can see some important lymphatic organs, one being the spleen. Another is the tonsils, another is the thymus, and we'll talk about other organs, but these are the three main organs in our lymphatic system. So what is the function? Again, I can't stress enough that this system is a drainage system. So it consists of a lot of, as you can see, fine networks of tubes all over our body, and they contain little nodes on them, as you can see. So when physicians, surgeons, when we go in and do biopsies, when we're doing a mastectomy, those sort of surgeries, sometimes you hear about us removing the nodes. So those are the lymph nodes that are part of these little fine tubes. So the purpose, again, of this system is to control the fluid levels in the body. So when these systems don't work properly, we get water retention, fluid retention. This system is also responsible to respond to bacteria, to fight off infection, to attack cancer cells, and to also absorb that in our diet from the intestine. So this lymph node, the network works with the spleen, which is here, works with the thymus, which is in our chest, to release lymphocytes or white blood cells. And that's why when you see folks who have cancer, they typically have very low white cell count, right? Their lymphatic system just is not adequate to produce a normal white blood cell count. Our white blood cells are really important to help us fight off infection. So this is the other reason why we see those who have infectious disorders, they have high blood counts, they have weak immune system, and the lymphatic system is not working properly. So let's get to the topic of tonight. What's lymphedema, right? Many of you may have never heard of it, but many of you have probably seen people who have excessively swollen lower limbs in their legs or excessive swelling in their arms. I'm sure you've seen it. Maybe you've had a friend that has had breast cancer. That's some of the more common lymphedemas that we see. When women have breast cancer surgery, because the surgeon has removed the lymph nodes to ensure there's no cancer, guess what happens? They're not able to drain that fluid. So what you'll see in breast cancer patients, they have these big arms, right? I have a girlfriend who has to wear a sleeve to really help reduce the swelling in her arm. So it's chronic swelling. It most often occurs in the arms, the legs, and it happens when blockage in your lymphatic system prevents the lymph fluid from draining adequately. Now, some people are born with lymphedema. That's called primary lymphedema. And then some people have secondary lymphedema. And again, we'll talk about the causes, but one of the top causes of secondary lymphedema is surgery, trauma or removal of the lymph nodes. So primary lymphedema is rare. It typically affects women. It usually affects their legs. It's an inherited condition, and it is caused by problems with the development of the body's lymph system. So these are some of the more common causes of primary lymphedema. Malroy disease. It's a congenital lymphedema. So it's a malformation of the lymph nodes that begins in infancy. Really sad. We see a couple of babies that are born like that. Meg's disease, which is a hereditary condition that causes lymph vessels to form without the valves. When there are no valves in those lymph vessels, right, they can't adequately move the fluid out of the body. This typically we see in childhood or puberty. And then there's something called late onset lymphedema. This is a rare condition that usually occurs after the age of 35. But secondary lymphedema is where most of you have probably seen folks who have real large legs and ankles or large arms. That is caused by one, surgery. So if the lymph nodes are removed in a excessive or extensive surgery like breast cancer, when we do pelvic surgery, when we do ovarian cancer surgery, when we do endometrial or uterine cancer surgery, we have to remove most of the nodes. Why? Because they can be a nidus for metastasis. So when we do that, those areas are damaged. It results with the lymphedema because the remaining nodes are just not able to compensate to drain the fluid. Cancer cells is another reason why we see lymphedema. My neighbor who was diagnosed with Hodgkin's disease, his first symptom was enlargement of the lymph nodes, right? So cancer cells or tumor cells that grow near those lymph nodes cause a blockage. It prevents lymph fluid from draining properly. Radiation treatment. You know, lots of women after breast cancer surgery have radiation treatment. It causes scarring of the lymph nodes or vessels, again restricting the flow. Infections or parasites can also compromise the lymph system. So this type of lymphedema is most commonly found in areas such as India, China, or Indonesia. Injury that damage lymph nodes or vessels may also compromise the lymph system, causing lymphedema. So those are the more common reasons why we see secondary lymphedema. So again, on the right, bottom right, I'm sure you've seen people that look like this. Their legs are swollen, they're large, and this is called lymphedema, right? This is blockage of the lymphatic vessels that lead to fluid retention. Some of us may look like this, right? We take a long flight to Hawaii, or we're at work sitting excessive hours, and we get up and we look down and we've got swollen lower limbs, right? That is a transient lymphedema. It's not as severe as this, but it's just because the fluid is not able to get up to the top of the body to those lymph nodes and glands to be excreted from the body. So again, symptoms of lymphedema: prolonged swelling in part of your body. It's very painful. I mean, these patients are in a lot of pain. If you know someone that has lymphedema of the legs or the arms, it causes a lot of heaviness and tightness. They can't really move adequately. Their range of motion is restricted. It's a lot of aching, pain, and discomfort. And hopefully the business partners on the line see where I'm going, because we have so many products that can address achy pain and discomfort. It can also cause recurring infection, right? Because we need the lymphatic system to adequately work so it can help to fight off infection. It causes a lot of hardened, reddened, and even thick skin. So not only is it painful because of the swelling, but the hardening of the skin is uncomfortable. And then we also see patients, I see them a lot with lymphedema, and there's so much retained fluid there, they start to leak the fluid through the skin, right? So it's really, really awful. These are some things for prevention, right? You want to prevent getting lymphedema. You want to prevent, if you have lymphedema, worsening of the lymphedema, because unfortunately there's no cure for lymphedema. All we can do is address and assist the symptoms of lymphedema. So what do? You really want to monitor the at-risk area. You know, I do hundreds of vaccines now every day, and I get patients who say, please don't inject my right arm. I had cancer surgery, I had breast surgery, I have a lot of swelling already. I really wish you would do my other arm. So you want to monitor those at-risk areas. You want to maintain a normal body weight, because obesity does increase your risk of developing lymphedema. We have products that address weight loss as well. You want to protect the at-risk area. You want to avoid injury, fractures, cuts, burns, blood draws, vaccinations. You want to make sure that that limb is away from any of those conditions. Exercise. Why? Because as you move, it helps the lymphatic system to remove fluid as well. You want to avoid tight clothing or anything that could restrict the at-risk area. We do recommend sleeves for our breast cancer patients, but it's not tight. It's just a compression sort of sleeve to help to drain the fluid. Keep your arms and legs clean, especially if they have started to leak fluid. You want to make sure that that doesn't turn into a wound or decubitus. Maintain skin and nail care are high priorities. So again, I can't stress this enough. There is not a cure for lymphedema. Unfortunately, there's not a cure, but there are some common treatments and ways to manage this condition. Massage is a big one. Manual lymphatic drainage massage. I do tummy tucks as well. And so one of the procedures that we recommend our patients, because lymph nodes are removed when the tummy tuck is done, is a manual lymphatic drainage to help move that lymph fluid around again, reduce the swelling. Exercises, you know, these are usually light exercises to help manage lymphedema. You know, as you're moving, it's helping to move that lymph fluid. Compression, we talked about compression. It's like a garment. They're called arm sleeves or leg sleeves. That will help as well. And then support groups. There's actually great lymphedema support groups. So if you know someone that has lymphedema, it doesn't treat those patients physically, but it does help them mentally, because these patients go through a lot. They go through a lot because people are staring at them. People are wondering why their arms or legs are so big. I mean, it's a very anxiety provoking and can cause depression as well. So let's now move on to how do we use CBD for lymphedema? How do we use CBD for lymphedema? And if you're new on the line, if you're a guest on the line, you may not know what CBD is. So we'll quickly talk about what CBD is. CBD is an abbreviation for cannabidiol, and it's one of the main constituents or compounds that comes from the hemp plant and the marijuana plant. In fact, it comes from the cannabis family. But what we do know is that the CBD that's sourced from the hemp species, that's a species on the left side, is an opportunity for people that we love, you know, our patients, our family members, to address symptoms that lymphedema causes without the high. Because when you source CBD from marijuana, which is on the right side, those products give you a high. They give you a paranoia. They give you a euphoria. And so many patients are looking for alternatives to address their lymphedema without the high. And so it is the CBD or cannabidiol that is sourced from hemp. Now, the difference between hemp and marijuana is that marijuana has high levels of THC, or delta-9 tetrahydrocannabinol. That's the compound that actually gives someone the euphoria. It has very small amounts of CBD, but hemp is the reverse. It has high levels of CBD and trace amounts of THC. That's why hemp doesn't get you high. It gives you the health benefits without the high. So when we look at CBD, and this slide may be blurry, or maybe Dr. Rita needs her glasses, but CBD has a long list of medicinal benefits. You know, CBD specifically, when we're speaking about lymphedema, helps to reduce bacterial infections. It helps reduce inflammation. It helps to reduce anxiety and depression. It actually works to put the body back in balance, specifically the entire body, the entire system that our body has. The lymphatic system, the endocrine system, the musculoskeletal system, the nervous system, right? And there's other compounds that the plant makes, but CBD is the main one that gives us these health benefits. It's a long list. But these other compounds like CBG and CBC and delta-8 THC, they're also important to work synergistically on a cellular level to help those who suffer from lymphedema with symptoms that they have. So CBD actually interacts with our endocannabinoid system, and we're going to talk about the endocannabinoid system to create homeostasis or balance. There are receptors that are found in our body, that are found in this endocannabinoid system, and they're found in the brain, the digestive system, the lymphatic system, the immune system, the periphery. It also binds with lipids, and as a result, this increases the intestinal lymphatic transport to move toxins out. So it acts as a detoxifier, and it also helps to detoxify the immune system. So detoxing the lymphatic system is a great way to ensure health, right? Because if the lymphatic system doesn't work properly, if it's not in balance, if it's not in homeostasis, guess what happens? We have all these toxins and fluid that is built up in our body. So another way that you can help to reduce lymphedema and the symptoms that come from lymphedema is eating wholesome foods. You know, I always say when we talk about CBD, it's not magical. We've got to pair a great diet, exercise, meditation, yoga, all of these things, dry brushing, massage therapy to help to assist with lymphedema. So the endocannabinoid system is the most vital regulatory system in our body. It regulates, again, so many systems and glands. You know, we talked about the three most important glands in the lymphatic system, is one being the spleen. And you can see that the endocannabinoid system has direct receptors on the spleen, one of the major organs in our lymphatic system. These receptors are called CB1 and CB2. You know, CB1 receptors, they are responsible for putting in balance the brain, the immune system, the lungs, the vascular system, etc. But CB2 receptors are important in the immune system as well, and the spleen, which is one of the important lymphatic systems, along with the skin, the liver, bone marrow, the pancreas, and bones as well. So this is a science behind how CBD works. This science was discovered in the early 1990s, and that's why we're seeing so many studies right now that really document the fact that this CBD can assist with even the lymphatic system. Now, this diagram here shows other organs in the lymphatic system. So we've got the spleen here, we've got the tonsils up here, we've got the cervical nodes. Part of the intestinal tract areas are part of the lymphatic system. Of course, the appendix is part of the lymphatic system. So this system, the thymus, which is in the chest, this system has receptors that are looking for CBD, cannabis compounds and constituents to put it back imbalance. I cannot forget to remind you that every chronic condition that we see in medicine, the common denominator is inflammation, right? In lymphedema, there is an increase of inflammatory cells, right? So we always want to look for CBD to reduce the inflammation. So this is just a study that talks about how the lymphatic system does not operate sufficiently because of the inflammatory processes that are going on. So CBD can be very, very effective in the treatment of the lymphatic system. You know, one way is using our products and massaging it in the body. You know, when you massage it, it helps to move the fluid, and it also helps to detoxify the body. So that's one way. Again, inflammation, there are studies that show that CBD is a powerful anti-inflammatory with conditions not only in the lymphatic system, but diabetes, inflammatory autoimmune diseases like rheumatoid arthritis, muscular sclerosis, lupus. All of those are inflammatory autoimmune diseases. And the studies show that CBD can help to reduce inflammation. There's other studies that brings me to the fact that many times we take Advil, or we may take Motrin, Aleve, we may take Tylenol, or even aspirin to address inflammation, to address pain. Well, one of the alternatives is CBD, because CBD works in the same exact pathway in reducing inflammation as these over-the-counter medications. And the reason why you want to stay away from these over-the-counter medications is because we know that long-term use of Motrin, long-term use of non-steroidal anti-inflammatory drugs like Advil, Motrin, and Aleve can cause chronic renal failure. Long-term use of acetaminophen or Tylenol can cause liver failure. So we want to use a holistic, natural, organic option, even for the inflammation and pain that we see with lymphedema. So again, this disclaimer before we talk about our products, it's important to know there is no cure for lymphedema, all right? And we cannot say that CBD will cure lymphedema. We can't say that CBD cures anything. You got to be real careful. So when we're sharing these products with others who have pretty severe, chronic, long-term conditions, you got to remember to say, our products don't cure, but our products absolutely address symptoms that your condition causes, right? Your conditions causes, but we have no cure. Also important to note that our products should not be sold or used by those under the age of 18. So consult your physician, make sure your physician knows that you're using CBD products. If you're on medication and your doctor has cleared you, make sure that you space your CBD from your prescribed medications about 2 to 3 hours apart. So here are our products here at Wakanna. So many products that can be used for those who suffer from lymphedema. Secondary lymphedema is mostly what many of us see. We are going to, again, go back to the symptoms. And this is important because we want to make sure that you never say that Dr. Rita said that if you take this CBD by Wakanna, it will cure your lymphedema. No, I never say that. But what I am saying is that we have products that can assist with the symptoms of lymphedema, can assist with the feeling of heaviness and tightness, the swelling, the inability to have a good range of motion, the aching, discomfort, the skin tightness, the hardness. All of these products can assist with the symptoms of lymphedema. So let's first talk about the topicals, because those are some of my favorite products that we're going to use on folks who suffer from lymphedema. Why? Because they have the pain, they have the swelling, they got the inflammation going on. Our topical products address those symptoms that many suffer from lymphedema have. We have our Power Extreme. These are products that will not pass the blood-brain barrier. These are products that can safely be used in those who have urine drug screens, right? So we have a 400 milligram, 200 milligram, 500 milligrams. These are topical creams that can be used to offer local discomfort, for those who have swelling, pain, and discomfort and aching from lymphedema. We also have a body mango cream. Our Power Body Mango Cream is great, right? Because those who suffer from lymphedema, they have hardening of the skin. They have a lot of, tightness in the skin. So this body cream, because CBD is anti-inflammatory, it's antibacterial, it will help to relieve a lot of the inflammation in the skin. The other topicals will relieve a lot of the discomfort and pain in the skin. We also have our Dr. Rita's Rub, which is here on the far right. This is a great product too that comes in an oil form that's used topically. I love the roller ball because you can just easily roll it on. So some people like the oil, some people like the cream, but absolutely, if you know someone who suffers from lymphedema, you want to recommend all of these topical products. Now, our tinctures, you may say, well, why would someone with lymphedema take a tincture? Why would they ingest CBD? Well, we talked about lymphedema having an increased level of inflammatory cells in the body. So we want to reduce the inflammation internally. So these tinctures are oils that you place underneath your tongue. You hold it for about 60 seconds before you swallow. And this is a great way, along with the topicals, to use in those who are looking to address symptoms from lymphedema. We have a product called our Hemp MD. This is our most potent product, our most potent tincture. That is going to be used absolutely for someone who has more severe lymphedema symptoms. They have a quality of life that has diminished because their range of motion, they can't really move because of the swelling and the fluid retention. And then we have a 500 milligram tincture for those who have moderate to mild symptoms due to lymphedema. This is a proprietary formula, our Power 500 milligram, because it has additional essential oils like black seed, turmeric, and peppermint that enhance not only the anti-inflammatory properties of CBD, but enhances the antioxidative properties. Then we have our water soluble. You can place in water, juice, smoothies. And then we have a product for those who have random drug screens. See, the topical products can be used safely for those who have random drug screens, but the tinctures, you'll have to use our pure or our broad spectrum product if you have random drug screens at your job and you're looking for something to use to address the symptoms of lymphedema, and that would be our pure product. That's 300 milligrams. When you start CBD, you always start low and slow, even though your condition may be really, really, really severe. Starting low and slow, 3 drops in the morning, 3 drops under the tongue in the evening, prevents you from having those minor side effects of excessive fatigue, nausea, and headache. And then we have our edibles. We have our flat belly coffee and gummies. We talked about how weight reduction can improve lymphedema. It won't cure lymphedema. There is no cure for lymphedema, but we can assist to improve the quality of life, and we can assist those symptoms from lymphedema. So that is our weight loss coffee. It contains CBD. CBD helps to turn that white fat into brown fat, that fat that helps to burn and increase metabolism and burn calories. We also have our gummies. Our gummies will help those with lymphedema to assist in their sleep, right? They're in a lot of pain. They're miserable. Many times they can't sleep because of the discomfort and pain. So our gummies, our pure or our broad spectrum gummies, are a great way to help those to assist in their sleep. We have a product that you can bake with, you can cook with, our culinary product. And then we have our immune defense tea. We talked about how lymphedema also is important in reducing toxins in the body, right? We can't do it because the lymphatic system doesn't work appropriately. So we need that immune defense tea to help boost the immune system, to help detoxify those organs and glands in the lymphatics, to help detoxify the liver. That's what the immune defense tea and the bitters are going to do. They're going to help boost the immune system. They're going to help detox. So we have a detox, our bitter here. We have immune boosting tea, which is our immune defense. And then we have, of course, our gummies, our edibles. And then we have our smokables. Our smokables are great products for those who have lymphedema. They want to address the symptoms of lymphedema pretty quickly. They may have an acute onset of discomfort from the swelling, from the hardness. These smokables will work in about 1 to 5 minutes. We have our hypnotic cartridge, our raspberry jane cartridge, our pre-rolls, and our premium flower. These smokables, again, can be used along with the topicals, along with the tinctures, along with the gummies. You absolutely can have smokables for those acute times of needing pretty fast relief. And then we have spices. We have a butter. So you can also recommend these products for those who are looking to address symptoms of their lymphedema. They can bake, they can cook, they can spice it up. We have our chili lime, our garlic fire, our Flavor King, and our vegan butter. Our vegan butter is amazing. It's non-GMO. It can be used in the oatmeal and toast, etc. So these are ways and different ways that one can consume CBD safely. So I want to thank you. I'm hoping that you have a better understanding of what lymphedema is and how important that when you see someone that has lymphedema, now you can really talk to them about assisting with their symptoms. CBD does not cure lymphedema, but it will assist with the swelling, the discomfort, the skin tightening, the depression, the anxiety that they have, the insomnia they have. We have teas that help for detoxifying the system. The bitter tea, the immune defense tea will help to improve their immune system. So all of our products, from our lotion to our spices, to our tinctures, to our topicals, to our gummies, absolutely all of these products can be used when we are helping those to assist them with the symptoms of lymphedema. So I'm going to stop sharing now. I'm going to take some questions. I've got my medical advisory board on. Welcome, ladies. We have Dr. Joy Smith, Dr. Betty, Dr. Charlotte Mitchell, medical advisory board. At any time, you can hop on in here. Let me know if you have questions. Maybe you want to make a comment, but I do know that there's probably some questions. So, hi, Dr. Rita. This is Mom Mitchell. Mom Mitchell is the one that sent me the email about doing this presentation. So let's all thank Mom Mitchell about lymphedema. I shared the story about my daughter. Okay, so Mom Mitchell, I'm going to have you share this story with everyone. I'm going to move you over to the panelist side, and I know we didn't rehearse this at all. So if you can speak, I would love for you to unmute yourself and speak, but if you can't, that's okay as well. But I did give you
I can hear you.
a microphone.
Yes, I can hear you. Can you hear me?
I can hear you. You can talk a little louder.
Okay. Can you hear me better?
Can you take your can we see your beautiful face?
Yeah, I guess let me check. Let me see if I can. Here we go. Here
There
I
you
am.
go.
I'm glad I'm looking halfway decent today.
No problem.
Hi, everybody. Yes, I shared a story, my story with Dr. Rita about my daughter when she was pregnant, and she was swelling quite a bit. And I shared with Dr. Rita the fact that whenever there's swelling, I say that's not good. But yet where she was going, they weren't addressing it, and so I just got really, really nervous, and they took her to Northwestern Hospital, and at that time they took her, and she was diagnosed with preeclampsia. And I had heard about edema when I was pregnant, but I didn't know about preeclampsia. I didn't even know what it was. And so I was just wondering, was that some type of lymphedema, the swelling, what causes that when women are pregnant? Because I know it was very serious among African-American women, and I know a few of them who have died from preeclampsia.
Absolutely, yes. Preeclampsia can be fatal, and both mom and baby can die. And there is a theory that it is a toxin that is released from the placenta. And this toxin causes a lot of inflammatory cells and constriction. And when you have that, like we talked about lymphedema, fluid cannot adequately move out of the body. And so moms are swollen around their eyes, they're swollen around their hands, they're swollen around their feet.
Wow.
It can lead to eclampsia, seizure, and death. So it's very, very serious.
Right, exactly.
So go ahead.
Oh, well, that was basically it. I just knew she's always been very small when she was, before she got pregnant.
Right.
And she just kept swelling. and I just said, this is not good. It can't be,
But did you do anything about it?
Well, I did some old remedies. This was before Wakanna.
Okay.
Way before her son now. He was born 2.5 months early.
Okay.
Almost 3 months early. And so I did some old fashioned remedies, the vinegar and brown paper and putting it on her. And just, we couldn't get the swelling down. She couldn't wear her shoes. I mean, it was awful.
Yeah.
And so finally, I'm like, we're going to take you to the hospital because this is not right. We're not going to go back to that clinic because this is not.
So now with the information that we have, in a pregnant mom, now we know that we can use a topical CBD, right?
Mm-hmm. Yes, definitely.
When you're nursing, you really got to talk to your OB-GYN. And though I'm an OB-GYN, I'm not your OB-GYN or your daughter's OB-GYN or anybody on this call OB-GYN, right? Because what Dr. Rita would do in her practice is totally different from what my colleagues would do. But absolutely, many pregnant patients have used topical CBD for swelling, for discomfort, for pain, and now we have the information tonight to really help us to address those who have lymphedema, who have retained fluid and swelling, products that are safe, products that are effective, and products that are affordable. So thank you so much for recommending, Mom Mitchell, this presentation tonight. If you're on the line, if you have a presentation that you want me to discuss, absolutely, we can do that. But we're going to take some more questions. Thank you so much, Mom Mitchell.
Thank you. My daughter is on the line too, the one that's.
Oh, good.
Yada.
Okay, so hi, daughter. We welcome you. Yeah, pregnancy complications are nothing to play around with at home. with CBD or anything else. That is true. Straight to the hospital.
Yes.
Straight to the
Straight
hospital.
to the hospital.
Hi, Dr. Rita. What type of diet would you suggest to have lymphedema and need to lose weight? Additionally, there is a machine I get daily for an hour to massage. Oh, good. So you do the lymphatic massage, Gloria. Yeah, I would recommend a plant-based diet. I would make sure that you are staying away from a lot of processed foods. Processed foods have a lot of sodium in it. That's why I recommend plant-based, a lot of fresh uh, vegetables, a lot of lean protein. You want to stay away from soy products and things like that. Lean protein, lots of vegetables, and of course, getting your water in. We've got great products, our flat belly coffee. We have our flat belly gummies, CBD, just using as a tincture with diet alone will also help you to lose weight. So yes, obesity has been linked to lymphedema, so we want to make sure we all have a healthy weight. Let's see. I don't see any other questions. Let me look at the Q&A area. What is the sweetener used in the gummies? How many calories? So there's 2 milligrams of sugar in the gummies. Very, very small amount, Karis. Are gummies only used at night? No, we have lots of customers and distributors that use our broad spectrum gummies. Those are the pure gummies during the day. So yes, gummies can be used during the day. Gummies can be used during the night. I have a friend that is a cannabis smoker. She is now 4 weeks pregnant and wants to know if she can still smoke, or what would you recommend? She would have to follow up with her physician to give a recommendation. The College of OB/GYN, the ACOG, does not endorse cannabis during pregnancy, Tanya. Body Adams asks, excellent discussion. My question is in regards to the tincture. Is it certified organic? Yes. Our tinctures are sourced organic farms in Colorado, Oregon, and Kentucky. And our tinctures have our certificates of analysis. You can look on the person's website that invited you to get all of that information about our products that are truly, truly amazing. Again, when you start CBD, start low and slow. 3 drops in the morning, 3 drops in the evening is a great way to start the tincture. Gummies at night or in the day, when you're starting, start with half a gummy. We have some new Delta 8 gummies. Oh my goodness. They are not like the other gummies. So you want to start out with 1/4 of our Delta 8 gummies. Our topicals are amazing because they can offer local relief. The lotion is amazing. They can address the hard skin in those who have lymphedema. So if you know anyone that has lymphedema, anyone that has had breast cancer surgery, now they have the lymphedema in the arm, you want to make sure that you recommend these products to assist with their symptoms. Won't cure lymphedema, but absolutely will assist with their symptoms. Any other questions? Yes, soy products just have a lot of hormones in them, and you don't want the soy, the estrogen, all of that causes a lot of swelling, fluid retention, so you want to stay away from soy products. Would lymphedema cause more gout flare-ups? Well, gout really is an increase in uric acid. Lymphedema is more fluid retention, but because it's the lymphatic system and because it's not working adequately and it's not removing toxins, possibly it could cause more gout flare-ups because you've got the toxins and increase in uric acid that the lymph system cannot flush out. So that possibly could happen. So you want to make sure that, you know, with gout, flare-ups can come from different foods, different alcohols. With all of these conditions, you want to remove, limit alcohol use. Alcohol is a neurotoxin. It kills our brain cells, and it has really no advantage for our body. So you want to limit alcohol, limit smoking. You want to get to moving, exercising. You want to drink your water. You want to get your sleep. Dr. Rita doesn't get enough sleep, but I'm preaching to myself, right? You want to get at least 7 to 9 hours of sleep. All of these lifestyle modifications, along with the CBD, becomes magical, right? You just can't think that using the little tincture is going to really do what you want. But when you add that diet, sleep, water, exercise, and our products along with those lifestyle modifications, that's when the magic happens. That's when the magic happens. Yes, get my rest. Get my rest. I think this will be the first weekend I've had off since Christmas, this Easter weekend coming up. So I'm pretty excited. Is lymphedema predominant disease in certain countries? You know, Meridian, I don't know. I don't know if lymphedema is predominant disease in certain countries. Does anyone know the answer on the medical advisory board? Can the tinctures be used topically? Yes, you can absolutely use the tincture and put it on topically. Yes, Kiris. I see TV. No, Lewis Cooper, I don't understand what you're writing. I see TV, Connor, Lias for oil on TV now are going that direction. I don't, please repeat your question, Lewis Cooper. The gummies are used for everything that you would use CBD for. It's just a different way of consuming CBD. So you can consume it in an edible, in a gummy. You can consume it in a tincture, in an oil. You can consume it in a topical. You can consume it in a smokable. You can consume it in a spice. It's just to your discretion which way you want to use the products. I recommend that what we call layer our products. I recommend using all forms, using the tinctures twice a day, using the topicals throughout the day, using the gummies at night, and using the smokables when you're having some acute condition that you need to address. So I recommend using all of them. But some people prefer others over one, so it is to your discretion. We want you to try all of our products and be consistent. You know, I find a lot of customers say, well, this is not working. Well, I mean, you've only been doing it for 2 days, right? It works differently for different people. It depends on your diet, depends on your weight. It depends on the severity of your condition. It depends on the body chemistry, your body chemistry. It depends on how you metabolize CBD. You know, all of these factors will result in how effective CBD is, how fast it will work. Just know that when you start low and start slow, just know you can always increase. In a week or two, you can increase to a higher amount. In another week, you can increase to a higher amount. But just know that be consistent so that the CBD can work in your system. Be vigilant about your diet. Don't think that you can continue to eat poorly and feel better. So all of these things, you have to journal, you have to record, and you have to do on a consistent basis. Dr. Betty, were you going to say something?
Yes, good evening, everyone. Thanks, great presentation, Dr. Rita. Thank you so much. There were a couple of things that I just really wanted to stress.
Can you talk a little louder, or maybe it's me? Can you talk a little louder?
Maybe it is me.
Okay, yeah, that's better.
Okay, So there are just a couple of things that I wanted to emphasize. I know you talked about exercise. Movement is very, very important. Our bodies, you know, especially during this lockdown, many people have been sitting a lot, sitting on doing Zoom, sitting watching television, just sitting, sitting, sitting. And that is definitely, could definitely be a precursor to the development of edema. So avoid a sedentary lifestyle. If you sit a lot, if you're doing lots of Zooms or watching lots of TV, get up every hour and a half and just walk around, flex and extend and flex your feet, you know, do circles, just keep everything moving. The lymphatic system is actually our body's sewage system. And the lymph is is a clear milky fluid that moves through channels. There are no blood vessels to squeeze it along. And so the only way that it moves is through the contraction and relaxation of our muscles. So if we're not moving, lymph is not moving. So again, you have a greater chance that you will experience edema. Then the other thing, Dr. Rita talked about massaging, using our great topicals. This is an excellent idea, but let me remind you, always massage gently, because lymph is very close to the surface of the skin. It's not really very deep, so you don't have to press hard. And the other thing is to always massage towards the heart. So gentle and light as you go. Then the other thing is, she talked about our CBD, which is awesome because remember, CBD activates the receptor sites in the endocannabinoid system, which balances all of our systems, and the lymphatic system is one of them. So CBD will definitely help to help our lymphatic system to work more properly. And then, like I said, the metaphysically, the lymphatic system is like our sewage system. So it's really about emotional garbage. So watch your thoughts and personal development, affirmations, positive affirmations, meditation, and those kinds of things will also help with cleaning some of that garbage out and hopefully keep you from adding more in. And I think that's it for me.
Wow, thank you so much, Dr. Betty. All of those things are so important, right? Positive thoughts, affirmation, getting active. You are just right on point with all we're doing is sitting on Zooms, meeting after meeting, grand opening after grand opening. So getting that lymph fluid moving. So thank you so much. Thank you. Making sure you're massaging towards the heart, not deep massage, right? Doesn't have to be a deep massage, but using our products. Thank you so much, Dr. Betty. Such great information. Well, it is 8:54, and what we want to do now is have time for you to contact the person that invited you. You want to contact the person that invited you so that you can get your additional questions answered. I have to go upstairs and deliver a baby. I've got to go to the ER and see a lady that's bleeding. So Dr. Rita's going to leave you with the person that invited you. Contact them. Let them know that you want to get started on these products immediately. Have a great night. Be well, be safe, and we will see you next week. And happy Easter, Resurrection Sunday, all of those good things, okay?